Now is Niall Dickson, the Chief Executive of the NHS Confederation, which represents the commissioners and providers of NHS services that have drawn up these plans. Welcome to the Daily Politics. The BBC analysis that you've seen shows hospital services will be scaled back in 2/3 of areas. So you can see why people would think that the plans that you're putting forward, the STPs, are a euphemism for cuts.
Yes, you could see that, but I don't think that is the case. What you're finding is, first of all, a set of organisations that, as Chris Ham has just pointed out, are under enormous pressure. So there is pressure in terms of trying to make the books balance. And that is a question that needs to be taken back to government, because I think the system is now in a more difficult position than it was when the plans were first started. But I don't think we should confuse that with the need for reform. There is a need for reform. There is a need for reform both to provide better services, but also to cope with a very large number of elderly people who are suffering from a number of different conditions, who are now overloading the most critical part of the system in terms of the hospital services, because there is inadequate services in the community. So changing that around and joining up is not an optional extra. It has to be done.
And Owen Jones, if we carry on that thread, the King's Fund says that these STPs, these plans, are still the best hope of delivering essential reforms in the NHS. Without those essential reforms, and because they haven't happened in the past, we are in the position we're in today.
Well, this isn't a euphemism for cuts, as you said. I mean, these are cuts, 2/3 involving closures or moving of services.
But does that make it a worse service?
Well, of course it does. Well, the danger is what we've seen with local authorities are the devolving of cuts from government to local authorities to protect the government.
In social care.
Exactly. So what we've seen with the NHS over the last few years, a few years ago they introduced the Health and Social Care Act. That introduced the principle of competition at the very core of services, privatisation, marketisation. We've had the longest squeeze in funding of the NHS as a proportion of our economy since it was founded, cuts to social care at a time of an increasing ageing population. So what these STPs will do in practice will be devolving cuts, and as we've heard from the Red Cross, the consequences of that has been a humanitarian disaster, a crisis, in the NHS. That's government policy which is responsible.
Is that what you're going to do as head of an STP plan, is devolve those cuts, give them to somebody else to enact, and they are just cuts?
No, well, I think the STP is the one that's actually making the decisions. And we use this letters STP as if it's something. It is actually the chief executives of all the organisations that are local. That is to say, the local authority, the health trust, the community, and bringing in the GPs, working together really in a coordinated way for the first time. So I don't think we should bogey the STPs. And I'm not suggesting Owen's doing that. He's absolutely right about the fact that the NHS and indeed social care have had a bad period in terms of funding. And we're starting to see the effect of that. The danger is that then either slows down or harms the work that the STPs are doing. But we shouldn't say that something is changed in the NHS, it means a cut. It can mean better provided services.
And isn't that the point that you are always flagging up, and to some extent the Labour Party, that this hospital is going to close this service, therefore it's leading to privatisation, cuts across the service, nothing must change. Whereas there are clear examples that where you do close some services and you concentrate stroke services, for example, in a fewer hospitals, more experts, the outcomes are better.
Reform, look, the problem with reform is when it is a euphemism for cuts and privatisation. That doesn't mean people like myself oppose reform. For example,
how do you get it through politically if you are forever flagging up cuts and closures as always being bad?
Well, look, what we've seen with privatisation, for example, is increasing bureaucracy, because to manage all the various different contracts you have within NHS, you need more and more managers, which is a waste of public money. But in terms of what we're talking about here, the NHS has been plunged, as the Red Cross says, into a humanitarian crisis. And what we saw in the 2010 general election, the Conservatives promised no more top-down reorganisations, which they did. And it's ironic now what they're doing, because they're arguing against increased competition, which is what they did a few years ago, with yet another series of reforms, which is devolving cuts to these STPs, so the government isn't held responsible.
Do you see it as a humanitarian crisis within the NHS?
I think it's a tragedy that we've got a situation where, for example, 2 million elderly people are now not getting any form of social care that they need, and the consequence of that is the kind of pressures that we're talking about in hospitals. But I think it is actually the job of my members to manage the amount of money that they're given and try and provide the best possible services. And I think that is what STPs and others are trying to do. But I do think it will take more time, as the King's Fund report suggests, and it is important that before you reduce or change a service at one level, you've got to make sure that the appropriate service is in the other place.
Just on that, I mean, the STPs administer the so-called £20 billion efficiency savings,
22.
Or 22 even, which the NHS is expected to administer. Now, in practice, those savings are a euphemism for cuts, aren't they, which will be detrimental to the quality of service within the NHS?
No, because that's an assumption that all £22 billion is simply a cut.
But the answer
is... But they are savings, aren't they? They are efficiency savings.
Any organisation, whether it's in the public sector or the private sector or whatever, does cost efficiency programmes. That is part of running an efficient organisation.
Sure, but if that means closing beds in any of these STP plans, how can that be a good thing when you have just said yourself the strain on the services and the strain on hospitals, and the British Medical Association says the NHS is at breaking point? That is a saving that surely we can't afford.
Well, the question is whether in an individual set of organisations you can build up community services to start reducing, and we are starting to see that.
But this would be closing beds before they've actually built those services up.
Well, you shouldn't do that. The answer is you have to devise new ways of organising the services. You have to change the way that we organise our services in the community in order to be able to do that. There is also, in each individual medical specialty, you can look at the best pathways for those patients. The reality is that across the country it is variable. Some places have it much more efficiently run, and we need to move towards that.
On reform, for example, at the moment we have what is not a National Health Service in lots of ways, but a National Disease Service. What we do is deal with the symptoms, if you like, rather than focusing on prevention. If we did far more in prevention in this country, then we would save the NHS a huge amount of money. That's reform we should talk about, but not closing beds, not losing staff, not losing hospitals. So that's the problem.
And that is part of these plans.
Prevention is absolutely at the centre of this, and it's not just the sort of primary prevention of saying, you know, do some more exercise and so on. That's all very important. It's also about how do you manage an elderly person who's got a series of different conditions in the community so that they're not going in and out. People are going in and out of hospital on a regular basis, which of course puts huge pressure on the hospital, very bad for the elderly people and very bad for the NHS's bank account. If we can do it more effectively, we can put care back into the community.
Niall Dickson, thank you. There will be some bleary eyes over the road in the House